Online Pregnancy School, your favorite program. My name is Dr. Linda Vanutu, and it's always a pleasure to come your way with this program. You know, pregnancy should be a time of joy. Unfortunately, because of the way things go, where people are not exactly sure of what to do, some of them do things that they are not supposed to do, or they leave things that they should do without knowing that they should do them. And that is why we are here to let you know what you can do when you are a pregnant woman, or when your wife is pregnant, when your sister is pregnant, to share this information with that woman so that she can go through pregnancy successfully. Our goal is that pregnancy should bring joy to the family. The woman should deliver, be healthy, and also have a healthy baby. Over the last few weeks, we have brought to you several topics that are very useful to the pregnant woman and her family. And my hope is that the men are also listening. One of the programs, somebody said that, but doctor, this is for women only. No, it is not. It is for everyone, whether you are married or not married. If you listen to this, I'm sure you will learn a lot of lessons that will help you. Today we are going to talk about a very interesting topic, and it is about the scan. A lot of people have heard about scan. Somebody says, my leg is painful, I'm going to the hospital for a scan. But we don't know whether that is what we have to do or not, and especially in a pregnant woman. What is the position, what is the place of the scan during pregnancy? And because we want you to be well informed, we bring you experts in the program. And this is why today it's a pleasure for me to introduce my guest, a medical doctor, a female, and I hope that the young ones are watching. Females are also doctors. They do all the things that the men do in medicine. So my guest for today is Dr. Efua Mensah. Doc, you are welcome.
Thank you.
This is the Online Pregnancy School. We educate the general public about pregnancy, delivery, childcare, fertility, everything that they want to know about reproduction. And today it's a pleasure to have you here to talk about scan, because there are so many people around who want to have scans done, but we don't know whether it is the right thing to do. Please introduce yourself. I know that you have a topic that we are going to talk about, but it is being done by a specialist, somebody trained in a particular area. So please let us know your title and who that person is.
I'm Dr. Efua Mensah, specialist radiologist at the Greater Accra Regional Hospital. A radiologist is a special doctor after completing 6 years of medical school. You go to school again, that is residency in radiology. In Ghana, it's 4 years. And after that, you are taught how to interpret radiological images. And radiological images, they are obtained by using X-rays and also other higher radiations to obtain images of the body, human body, in the internal organs and all the other structures, in order to see a pathology, that is any disease that is ongoing in the body.
So ladies and gentlemen, Dr. Mensah is a radiologist, a specialist radiologist. You know, medical school is 6 years for the general person. That is, if by God's grace you are able to go through, you pass, it is 6 years. After that, you do some house job, you do some training, and all that is part of your training. Now when you decide that this is the area that I want to specialize in, like she has done radiology, you go for another 4 years. So you can imagine that within these 4 years, she's trained. They've taught her a lot of things, and she's talked about imaging, she's talked about radiology, X-ray. I'm sure a lot of us know X-ray, but today we are going to go into detail about the X-ray, the other machines that are used, and then what those machines help us to do. She's mentioned pathology, and she explained that that is disease. Disease means that that particular thing, she says internal organs, that means the liver, all the things we have inside, they are the internal organs. And once they are not functioning well, then they are diseased. So the radiologist's work is to help to make a diagnosis, to know exactly what is wrong so that the proper treatment will be given. Doc, that is it, right?
Yes.
Okay. So now, about general radiology. What is the difference between a simple X-ray and then the scan? What is the difference?
Okay, so for X-rays, radiations are involved, but for a scan, no radiations are used. We have another imaging modality called magnetic resonance imaging, that is MRI. That one, to no X-rays or radiations are used here. So pregnant women can always undergo ultrasound scan without any fear of the baby being affected.
Wow.
As well as MRI.
I'm sure a lot of people have heard about MRI. So today, the full name is what?
Magnetic resonance imaging.
Take a pen and write it. Magnetic resonance image. Right. So that is MRI. We are learning. That is MRI. So if you have heard MRI, I'm going for the MRI at the hospital. Now you know that it is not just a simple word because it has a meaning. Doc, so somebody says that I'm going to the hospital. So the X-ray, he said there are radiations that are involved. And that is why when you go to the hospital, you are going to have an X-ray. The person who is going to take it will run somewhere. They run, right?
Yes.
Behind. Why do they do that?
In order to prevent them from receiving the radiations, because they always work there. And radiations, long-term effects of the radiations may cause cancer and have other effects on them. Those the workers there. Yeah. But same to those who also visit the hospital. So usually doctors don't keep on recommending X-rays all the time. They make sure that
is very important, because some people, the slightest thing, they say I'm going for an X-ray. When I went to the hospital, they didn't do the X-ray. It is because the radiation is not good for the person. Okay, that is fine. So there's a difference between the simple X-ray and then the scan. Now, let's zoom on to the pregnant woman. Pregnant women come to the hospital and X-rays are done. Scans are done. Ultra scan, yes. What is it? Why do they do it?
Okay, so an ultrasound scan is the use of high frequency sound rays to view the internal organs of the body, like liver, spleen, the pancreas, gallbladder, kidneys, uterus, and bones as well. Though bones are not well seen under the ultrasound.
Okay.
For a pregnant woman, when an ultrasound is requested for you, you don't have to worry at all, because one, it wouldn't have any effect on you, and also the baby as well.
Okay.
So you just have to free your mind and come and do it.
Okay. So when they go, what do they look for? So the doctor requests for a scan. Why do they request for the scan?
Okay. So the doctors request for ultrasound scan because, first of all, they want to know the date, your expected date of delivery, so that they have a fair idea of what to do for you. And you, the mother as well, you should know when the baby is supposed to come, so that you make preparations towards it. And again, we have to know the position of the pregnancy, whether it's inside the uterus or outside the uterus. Because if the pregnancy is outside the uterus, it means it's an ectopic pregnancy and it's not going to survive. So the earlier it's detected, the better, so that an intervention will be done about it for the woman. And it saves life.
Okay, so how early is that one, that the first one that pregnant women have done? How early?
Usually, the moment you see that you've missed your period, you're supposed to go and tell your doctor or the midwife or physician assistant about it, and then they will carry on a urine pregnancy test for you. Before 6 weeks, the ultrasound, dating, and also the gestational sac it's not, it can be, the gestational sac can be seen, but the dating may be difficult. So it's better to go between the 6 to 8 weeks of pregnancy.
Right. Ladies and gentlemen, we have looked at the first trimester of pregnancy in our previous discussion. So please visit my Facebook, Dr. Linda Vanoji, and watch that. She has just given us a very important information. As soon as you miss your period, please go to the hospital. Let it be confirmed that you are pregnant or you are not pregnant. And once you are pregnant and the scan is done, she says that they check whether it is an ectopic or not. Ectopic means that it is not at the right place. So if you go to the hospital and they check and they find that the pregnancy, instead of coming down, and you learn all this from our previous discussion, instead of coming to lie inside the womb, it is not coming down, but it is staying there. She said that it will not survive because that space is not big enough for the pregnancy to be there and grow. So please take note. And then she also talked about the sac. The baby lies in something. So she says that that is that. So doc, it means that when women are pregnant, they should try as much as possible to go during the first few weeks, isn't it?
Yes.
If the scan will be helpful.
Very, very.
So when is the first one done?
The first scan is usually done between 4 to 8 weeks.
Okay.
Once a woman sees that her menses is not coming, and then a UPT is done to confirm. Or sometimes you may go and when the scan is done, the gestational sac will be seen.
Okay.
Yeah.
So that shows that she's pregnant.
Yes.
Okay. So when they do the scan, what do they see?
Okay. So when the scan is done, we will see a hypoechoic area.
Hey, that one is big. Please take your pen and paper.
Which is around hypoechoic area, which is referred to as the gestational sac. And that is very early pregnancy, around 4 weeks. That is the only thing that will be seen. And then after some time, you see the fetal pole as well. And even around 6 weeks, the heartbeat of the baby is detectable on the ultrasound scan.
So what is the hypo? What did you say?
Okay, so those are radiological things.
They are radiological.
I don't disturb you with that.
No, but you see, I just want people to know that it is not just anywhere that you can have this stuff. We have been told that after medical school, you go to school for another 4 years to be able to do what you are doing. I'm talking to Dr. Efua Amwa Bensa. She is a specialist radiologist at the Greater Accra Regional Hospital, RAGE. We are talking about the scan during pregnancy. What is it? Why do we have to have the scan? And what does it show us? And please remember, at the age of 6 weeks of pregnancy, the baby's heart is already beating. If you don't want to be pregnant, don't be pregnant and think that this is not a human being. 6 weeks, the heart is already beating. That is a human being. So we see all that during the first few weeks of pregnancy. And what is the use? Why should I come? If that is, why should I come?
It's necessary to come so that we will know the progression of the pregnancy, that if everything is well. Again, after the formation of the heartbeat and all, if there is something called an embryonic gestation, which the gestational sac, instead of it being an oval regular structure, it will be deformed, and also there wouldn't be any fetal pole or heartbeat within the fetus that is in the gestational sac. And in that case, it means the pregnancy can't progress. And something should be done about it, as in the OBGY will have to do an EOU to an evacuation. Yes, evacuation to remove what is there.
Okay, so it means that at that age they look at whether the woman that has lost, that hasn't seen her pregnancy, her menses, they see whether she's pregnant. If she's pregnant, is this baby normal? Is that sac the uterus? Exactly. Is it in the uterus? So you see, at that age, there's a lot that can be done. So who should request for a scan to be done?
Okay. So a physician can request for an ultrasound scan. Aside that, your obstetrician gynecologist, also a physician assistant can do same, or your midwife.
Okay.
Yeah, in the smaller hospitals, especially, or medical centers.
Okay.
And can request for the scan.
So when it is requested for, where should they go? Because I see that there are so many. Sometimes you are driving around and you find that there are these small corners and they have a sign to say that we do ultrasound here.
Okay, so as someone who is in that profession, first of all, I would advise all my sisters that we should go to the government hospitals. Usually in the government hospitals, they have well-trained staffs. They may not necessarily be radiologists, but we have sonographers as well. They go to university and are trained for 4 years. And after that, they do service and undergo training with the radiologist. So at least they have a fair idea of whatever they are scanning. And again, some of the staffs too in the hospital, the midwives, they are trained to do the obstetric scan, so they are good at it. At least that one is better. And we have some other HEFRA-approved institutions around in Accra here especially. All pregnant females can go to these areas, but please, we should all be careful. Whenever a scan is being done for you, you should ask questions. If you see the person is not so competent in this, whatever he's doing for you, then you should think twice that there should be something wrong somewhere.
Wow. But see, sometimes it's not easy that the pregnant woman sees, she's given a form to go and do the ultrasound. She sees a place and she thinks that that is it. But I like the idea that if you are not sure, just go to a government hospital. That one you can never go wrong, isn't it? You can never go wrong. And when the scan is done, who interprets it? Can the midwife interpret it? Can the physician assistant interpret it? Or what should be done after they
when the scans are done? They are taken back to the hospital to see your midwife and then also the obstetrician gynecologist. In Ghana here, usually the doctors, the gynecologists looks at the scans and tell you whatever the one who did the scan saw and explain things to you.
Okay. Good. Look, now looking at the various trimesters in pregnancy. The first trimester we have talked about, that's the beginning of pregnancy, where they look at the sac, where they look at where the baby has been implanted, whether it's in the womb or it's an ectopic, and then whether the sac even contains the baby at all, the shape and all that. Now moving forward, are there any changes that are seen as the pregnancy progresses? What do we look for when the scan is done?
So basically, we have 3 main scans that a pregnant woman should undergo. Okay. That is someone who has an uncomplicated pregnancy. That's the first one is for the booking during the first trimester, and also we have Anomaly Scan that is done between 18 to 23 weeks of gestation. And for the Anomaly Scan, the one doing it or the radiologist looks out for any pathology on the baby. For instance, we check the vertebral body, if all the bones are well formed. Again, the limbs, upper and lower limbs. We check the internal organs, the heart, the lungs, the kidneys, also bladder. And again, if there are other pathologies, it will be well seen when the scan is done during the 18 to 23 weeks, and that one is referred to as an anomaly scan.
Okay, so that should be done by every pregnant woman?
Yes, it's very, very necessary.
Okay, so that is the second one?
Yes, please.
And that is in the second trimester?
Yes, please, between 18 to 23.
Okay, so now they check whether there's an anomaly, is there's an abnormal thing?
Yes.
Right, whether that is that. So it is important that the pregnant women stick to the antenatal schedule that they are given. All right. So going forward, what else do they look for?
Okay. So as the pregnancy progresses, the radiologist also looks out for the liquor volume, also the expected fetal weight of the baby, presentation of the baby. Placenta location is also very, very important for determination of those with placenta previa, which will cause a lot of bleeding abnormal bleeding during the pregnancy. And also we check for the cervical length too as well. That one is usually done before the anomaly scan is done, so that we'll know the cervical length and if the patient is competent to carry the pregnancy. That is, the uterus is good enough to carry the pregnancy, because some people also have to undergo cervical secretary, that is tying of the neck of the womb to prevent the pregnancy from coming out.
Okay. Ladies and gentlemen, this is the online pregnancy school. My guest for today is a specialist radiologist. She's Dr. Efua Amwa Mensah. She works at the Greater Accra Regional Hospital Range. My name is Dr. Linda Vanutu. The scan is a very important thing that is done when people go to the hospital for their antenatal. We are asked during the pregnancy period to have the scans done. We have been told about the first one that is done. We've been told about the second one. Somewhere along the line, the baby comes out because the end of the womb opens earlier than time. They put they kind of sew it to keep the baby inside, and that's why she said that during that time we look at the length of the cervix, the length, to know how it is and what can be done. And then you also talked about the liquor. The liquor is the water that the baby lies in, and it's important that it is of a certain quantity, isn't it? So the scan is able to help to do that. And then you also talked about the weight of the baby, because at a certain stage the weight should be,
so that we know if baby is going well or not. Because we have something called IUGR, that is intrauterine fetal retardation, which means that the baby is not growing well, the weight is smaller for the gestational weight.
Yeah.
So when it happens like that, it will give a fair idea of the obstetrician gynecologist of what to do next for the mother. And again, in diabetic patients and also hypertensive mothers too, all these things are important for them to rule out any pathologies in the baby.
good. So ladies and gentlemen, she also mentioned about the placenta, that they look at where the placenta is. Why is it necessary to know where the placenta is?
So it's important to know where the placenta is, because usually when the placenta is low lying, or there is something called placenta previa, the mother will always be bleeding intermittently during the pregnancy period. But if this is known, at least the obstetrician gynecologist will advise the mom about whatever situation she's in and how to cope with it and adjust. And also the moment she sees any blood coming or something, she should come to the hospital immediately, so that the necessary intervention will be done for her, rather than taking things easy and normal and thinking that nothing is happening. But meanwhile, she's losing blood, and at the end of the day, she will die.
Yeah, it's important. You see, placenta previa, the placenta is low. The placenta should be placed somewhere, and you see it in the photo that the placenta should be somewhere. And that is why you don't have to go to anybody at all to have a scan done. No, because the person may not be able to explain all this to you. But the specialist radiologists, they take time to read whatever is on the scan, and they can help the midwife or the doctor to make a decision about how the baby is growing, how the mother is, and even what to do. Doc, now going forward, the third trimester. So we've had 2 scans now, is that correct? We had the early one to check, and then we had the anomaly one. Is there another one that is done?
Yeah, a third one is usually done, and for the third one, we look out for the weight of the baby is important, presentation of the baby, whether the baby is coming with the head or it's a
so that is the presentation.
Yes, which presentation, because that one will determine the mode of delivery for the baby.
Yeah.
And also the weight of the baby helps the obstetrician gynecologist to decide on how baby will be delivered as well. For a big baby, definitely the doctor will decide a CS because it's big. But usually for the normal size babies, the mother will have to deliver herself.
You see, that is very important, because I remember one time a woman, I don't know where she had the scan done, but the scan gave the baby's weight as one that she could deliver normally. Then the midwife, wherever she went to, they didn't refer her because per the scan she could deliver by herself. Unfortunately, when she went into labor, she could not deliver. And when she went to the hospital, they saw that this baby was so big that there was no way this woman could deliver. And this beautiful, beautiful baby, as the baby was coming out, the baby was dying. And the baby died by the time the baby came out. But if this scan had been done at a place where a well-trained person had read it, then it means that the doctor would have been informed that this is a very big baby that cannot be delivered by this woman. So it is very important. So in the last trimester, they look out for the weight of the baby and what else?
Presentation.
The presentation. That means how the baby is lying.
Yes.
Okay.
And they check the lipo volume. So also the fetal tone, the respiratory rate, all those things are important to help the doctor to know if baby is well or not in the mommy's.
Okay, so dear listeners, this is the online pregnancy school. We are talking about the scan. We have heard so much. The scan is not just anything that you go to the hospital for. It has a purpose. So before a scan is prescribed, that go and have a scan, that the doctor knows exactly why he or she is asking for it. And it should not be done just by anybody. It should be done by somebody who has been trained to do this. Doc, we will see how it is done so that people can appreciate what it is that the woman goes through. So we'll see a pregnant woman going through that process of having the scan done. Dear viewers, let's visit the hospital and come back, see how the scan is done, and then we'll also have a conversation about what they look for and everything.
So we have a patient here who said, according to her, she's 8 months pregnant, and then she came for antenatal clinic at the hospital and was asked to do a scan. Unfortunately, the doctor didn't write any specific history, but at 8 months, we will look out for the lipo volume, also location of the placenta, and then the weight of the baby and the presentation of the baby. All these help us to know the mode of delivery for the patient. So for an ultrasound scan, the patient is positioned, will lie on her back, and then we cover her, but we leave the lower part of the abdomen so that the scan can be done at that side. We put an ultrasound gel which is just cold. It doesn't have any side effects either on the baby or the mother. And then we use our probe to do the scan. So you can take a notice of the scan. So on the scan, on the main machine, the screen will show whatever is in the abdomen. Over here, we can see the head of the baby. And then we look for the presentation. The baby's head is down, which means that it's good. It's coming with the head, especially at 8 months. Again, we look out for the placenta location. Which is up here. Again, we check for the lipo volume. We measure 4 quadrants. this is how the measurements are taken, and then we use that to determine whether it's normal or abnormal. That is, the lipo volume is adequate or inadequate. After looking at the head of the baby, the presentation, we take the necessary measurements for the baby's head and also the baby's abdomen and the femur length. All this helps us to get the fetal weight. So now I'll look for another parameter, that's the femur length. Parietal diameter for the head. We check for the weight of the baby. So over here we had 32 weeks 5 days, that is the average gestational age, and then the baby's weight as 2.2 grams. The baby's weight as 2.2 kilograms, sorry, not grams. We will now move on to how to do an anomaly scan for a pregnant woman. An anomaly scan is checking if every part of the baby is formed well, the organs, the bones, and everything, making sure that everything is fine with the baby. Usually it's done between 18 to 23 weeks gestation. So over here, that's the baby's eyes, one of them being seen this way. We have baby's mouth here. The baby's vertebral bones posteriorly are seen over here from the neck region, that's the cervical region, going downwards. That's the baby's heartbeat here. So that's the beating of the baby's heart. You can all hear it. Then we move on to have a look at the lungs. We have the right lung here and then the left lung over here. Then we go into the abdomen. You can see bowel here, then baby's stomach is here. That's the baby's bladder with urine in it as well. This is the right kidney of the baby. We have our left kidney over here too as well. We can also see the baby's legs here. They are bent, so it may not be seen significantly well. Then we have the upper limbs here. It's also bent as well. The humerus is here, and then radius and ulna down here. We have baby's fingers coming this way. We count and make sure that they are 5 and everything is normal as well. So basically, this is all an anomaly scan is about. We will end here with this session. So I'm done with the scan, and what I'll say is that we shouldn't be afraid or have any hard feelings about ultrasound scans, because they don't give any radiations or have any adverse effects on both the mother and then the baby as well. So we should willingly do it. It helps us to know if the baby has any pathology, and even for the mothers as well. It helps doctors to know the mode of delivery for the mother to prevent any deaths that may occur. Thank you very much.
Doc, thank you for showing us round. And now that we have seen all that is done, what are your final comments for our viewers? What should they know about the scan? But before then, please, if you have any question, this is the online pregnancy school. We are always happy to answer your questions. Send me a WhatsApp on 059 242 0625. 059 242 0625. My name is Dr. Linda Vanotu, and my guest for today is a specialist radiologist, Dr. Efua Amwa Mensah. Doc, so what are your final comments for our dear viewers?
Okay, so my advice to our dear viewers is, please, we should always make sure that we go to a government hospital or a HEFRA approved institution for our pregnancy scans. And then again, whenever a pregnancy scan is being done for you, you have the right to ask all the necessary questions that you have. If you don't understand anything, you are free to ask, and just don't keep quiet, because if someone who doesn't know whatever he or she is about is scanning you and you ask questions, I'm sure the person may feel uncomfortable, and that will help you to detect that you are at the wrong place. So bear that in mind. Thank you.
Right. Bear that in mind. Don't go to anybody at all for your scan. The scan helps to make a diagnosis. The scan helps to plan for your management. The scan helps you to go through the proper means of delivery. Please, we have learned a lot that at the beginning of pregnancy, a scan is done for a particular reason, to see where this baby is going, to see whether this baby is normal, whether the sac is normal, the shape of the bone, the heart, whether it is beating, and all that. And sometimes, look, people want to know whether I'm carrying a male or a female baby. When do you do that?
Interesting. Well, that one is usually done around 18 to 24 weeks.
So it's for the abnormal, that one that they check the abnormality.
Yeah, usually if you don't tell the doctor that you want to know the sex, we don't tell you, because we believe it's your right. So you are supposed to let us know whether you want to know the sex of your baby or not.
That is very important, because somebody might be looking for a girl and the baby is a boy. So if you go and tell her that this is a boy, she may hate the baby right from that. Some people cry because they tell them that this is every human being is a human being, isn't it?
Oh yeah.
And what a man can do, a woman can also do. Now we have men who cook. Previously it was women. Now women are doctors. We have surgeons, we have O&D specialists, we have radiologists, we have public health, we have everybody, male and female. So that will not be a problem. So if you want to know the sex of your baby, when you go to do this, now please tell the person doing it that I'd like to know. And then, look, I visited somewhere and with a pregnant lady, and they did the scan, and they were even able to tell at that time about the kidney, how it was functioning, and all that. They looked at all the internal organs as you mentioned of the baby.
So that is part of the anomaly scan that
Okay.
we do. We look out
The
for
second one.
kidneys, yes, the liver, the baby's lungs, heart, everything. We check everything, even how the eyes are formed, if the whole body is intact, the limbs, the fingers, toes. Yes. So anomaly scan is not supposed to be done in 5 minutes time. No, it takes not possible.
Okay.
Yeah.
It takes a long time. Wow. So you see, don't just go anywhere, please. Don't just go anywhere for your scan. Go to a well-trained person. They will check to make sure that this baby is coming out and is coming out well. If there are any challenges, they will let you know. And I know that even sometimes they use the scan and they offer treatment while the baby is still inside, isn't it?
That's that in Ghana here.
We haven't started
yes,
that one,
but outside that is done.
they do that.
Yes.
They're able to perform. Yeah.
Surgeries and all that for the baby.
The baby is still in the mother's womb.
It's interesting.
Wow, that is an interesting aspect. So for those of you who want to be medical doctors, this is a very interesting area. When you are done with the medical school, go and do radiology. Be a specialist radiologist, because very soon we'll be doing all this. Doc, I want to thank you so much for this time. You have given us a lot of insight into what happens when the pregnant woman comes to the hospital and why the scan is also done. Dear viewers, this is the Online Pregnancy School. My name is Dr. Linda Vanutu. It's always a pleasure to come your way. And today we have looked at the scan in pregnancy. See you another time. Bye.